Hi, my name's Emily Bach. This is going to be my neuro assessment for NU650 Advanced Health Assessment. I consent to being in this video. This is my dad, Walter. Do you consent to being in this video?
Yes.
Okay, so getting started with the cranial nerves. Starting with the olfactory, the sense of smell, I'm going to have you close your eyes and occlude one of your nostrils. Breathe in. Good, so it's patent. Now I'm going to have you identify the scent.
Mint.
Good. Moving on to cranial nerve 2, starting with the visual acuity, I'm going to have you cover one eye and then read from the smallest line.
LTFPH.
Good. So it's 20/20 visual acuity. Next, what I'm going to do is check your visual field. So I'm going to have you look straight ahead and tell me when you can see my wiggling fingers.
No.
Good. Oops, sorry.
No.
Good.
No.
Good.
No.
Good. Moving on to cranial nerve 3, 4, and 6. I'm going to have you look straight ahead and then follow my finger with your eyes. Good. Moving on to cranial nerve 5, trigeminal. That's first, it's sensory and motor. So first I'm going to have you clench your jaw. Good. And then open your jaw. Good. You have adequate strength. I'm going to check sensation. So it's sharp and dull. This is dull. This is sharp, okay? Close your eyes and tell me if you feel sharp or dull.
Dull. Sharp. Dull. Sharp. Sharp. Dull.
Good. Moving on to facial, I'm going to have you smile or show your teeth. Good. Scrunch up your forehead. Like raise your eyebrows. Good. Close your eyes really tight. Good. Next, puff out your cheeks. Good. And then scrunch your neck muscles. Good. Perfect. Moving on from cranial nerve 7 to cranial nerve 8, I'm going to say a combination of letters and numbers, and I want you to repeat it back to me. Close off your other ear. Good. A3C.
A3C.
Good. Moving on to cranial nerve 9 and 10, I'm going to have you say ah.
Ah.
And one more time.
Ah.
Good. So the uvula is midline, the soft palate rises symmetrically, and the posterior pharynx moves immediately. And then, are you able to gag at all? Good. Moving on to 11, I'm going to have you shrug your shoulders. Good. And move your head side to side towards me. Good. The other side. Good. And then cranial nerve 12, hypoglossal. Can you stick your tongue out? Or just open your mouth? Good. So the tongue is midline, symmetrical bilaterally. Can you stick your tongue out straight? Good. And move it side to side? Good. Perfect. So moving on from the cranial nerves to sensory, I'm going to start with light sensation. I'm going to have you close your eyes. Can you tell me when you feel the sensation?
No.
Good.
No.
Good.
No. No. No.
Good. Next is going to be pain. So it's similar to what we already did, soft, dull and sharp. Dull, sharp. Okay, identify which one when I touch you.
Sharp.
Good.
Dull. Dull.
Good. So usually if you couldn't feel the pain sensations, we would do temperature, testing cold versus hot, and see if you could identify it, but since yours are intact, we don't need to. Next, what I'm going to do is position sense. So I'm going to have you close your eyes and I'm going to take your thumbs. So this is down and then this is up. I'm going to have you identify each finger, okay?
Down.
Good.
Up.
Good.
Up. Down.
Good. And I'm going to also check vibration.
Yep. Yes.
Good.
Yes.
Good. Perfect. So vibration sensation is intact. Moving on, I'm going to give you an object. I'm going to have you identify it. So you're going to keep your eyes closed.
Coin.
Good. Keeping your eyes closed, I'm going to draw a number in your hand and have you identify it.
7.
Perfect. And then keeping your eyes closed for these next ones, I'm going to have you tell me if you feel 2 points or 1 on your fingers.
2.
Good.
1.
Good.
2. 1.
Perfect. And then I'm going to touch various parts on your body. I want you to tell me where you feel you're being touched.
Leg. Arm. Belly. Shoulder. Cheek.
Good. And then I'm going to have you tell me if you feel you're being touched symmetrically or just in one spot. So close your eyes again.
Symmetric.
So 2.
2. 1. 2. 2.
Perfect. So moving on from sensory to motor, I'm going to test your elbows first. So I'm going to have you flex your elbow and don't let me push you down. Good. And then don't let me push you up. Good. Make a fist. Don't let me push you down. Good. Testing your fingers. Next, I'm going to have you spread your fingers. Don't let me close your fingers. Good. And then squeeze my hand as hard as you can. Perfect. Next, what I'm going to have you do is lay down on your back. I'm going to have you press your leg up, testing your hip. Good. And press down. Good. Next, I'm going to try to squeeze your legs together. Don't let me. Good. And don't let me separate. Good. Testing your knees now. I'm going to have you bend your knee. Press out towards me. Good. And then don't let me pull you forward. Good. I'm going to have you dorsiflex. Point your toe towards you. Good. And then press down like you're pressing the gas. Perfect. Next, what I'm going to do is the meningeal signs. So I'm going to have you bend your neck forward. Good. Perfect. And the next thing I'm going to do is Kernig sign. So I'm going to bend your knee and extend. Is that uncomfortable at all?
No.
Good. Perfect. So next what we're going to do is I'm going to have you sit up for a minute and I'm going to test your reflexes. So bicep. Good. Flexion, tricep. And you have a little bit of diminished reflexes. And next I'm going to check your knee. You have diminished reflexes. Next, your ankle. I'm going to dorsiflex it up slightly and tap your Achilles tendon, which again, it seems like your reflexes are a little bit diminished. Next, what we're going to do is coordination. So I'm going to have you move your hand back and forth like this, tapping your shin and go faster. Good. Next, what I'm going to have you do is press, tap each finger on your thumb like this. Perfect. I'm going to have you take your foot and move it up your shin heel to shin and down. Perfect. And then for the final thing, I'm going to check your gait. So I'm going to have you stand up. You're going to walk heel to toe. Good. Next, what I have you do is walk on your toes. And then hop on one foot. Good. Perfect. And then I'm going to have you bend down, like do a low knee bend without actually fully bending down. Perfect. Next, I'm going to have you do the Romberg test, which is, so you stand with your feet together, and then eyes closed, and it's supposed to be for 30 seconds. And you have minimal sway, which is normal. Next, we are going to check pronator. So I'm going to have you put your arms out straight, close your eyes. Good, so that was normal. And that would conclude our neurological exam. Thank you.